Let's talk about something we've all wondered about. When a bug is going around, why is it that some people get completely wiped out, while others, they don't even get a sniffle? You might think it's just random, just bad luck. But what if getting sick wasn't random at all? Let's get into it, because there is a real story, a real recipe behind every single illness.
I mean, this is the big question, isn't it? We've all been there. You and your friend are exposed to the exact same thing at the exact same time, and you get two totally different results. Well, the answer isn't some big mystery. It's actually a science.
And that's the whole idea right here. Thinking of a disease less like some random lightning strike and more like a recipe. It needs specific ingredients. They have to be combined under just the right conditions to get the final product, which in this case is being sick. So today we're going to break down that recipe, step by step.
All right, so let's start with the ingredients. In public health, this recipe has a name. It's called the epidemiological triad. It's this classic foundational model for really understanding how diseases get started.
See, it's never just one thing acting on its own. It's an interaction. It's the perfect storm of three different factors all coming together at the right time that allows an illness to grab hold.
And this simple table just lays it all out beautifully. You've got the agent, which is kind of like the seed of the illness. Then you have the host, that's us, the person, who is like the soil. And finally, you've got the environment, which is the climate that everything happens in. You need the seed, the soil, and the climate for that seed to have any chance of growing. Okay, so let's dig into that a little deeper. We're going to look at the first two ingredients in our recipe, the agent, our seed, and the host, which is the soil it's trying to plant itself in.
So what exactly do we mean by an agent? Well, it's the spark, it's the trigger, it's whatever kicks off the whole disease process. It is a necessary ingredient, for sure, but as we're about to see, it is absolutely not enough on its own.
Now this is where it gets really fascinating. Because look how broad the term agent actually is. We all think of the biological ones, right? Viruses, bacteria. But an agent could also be a lack of something, like a vitamin deficiency. It can be a chemical, like a poison or an allergen. It can even be a social factor, like intense chronic stress. The seed of an illness can come in so many different forms.
But here's the thing about seeds. If you toss one onto solid concrete, it's not going anywhere. It needs fertile soil. And in our recipe, that's the host. The host is the person, and it's our internal condition, our personal soil, that decides whether that agent can actually take root and cause a problem.
And this is where it gets really personal. Our soil, so to speak, is made up of all these different risk factors. Some of them are things we can actually do something about. What we eat, whether we exercise, if we smoke, those are the modifiable ones. But then there are the non-modifiable factors. We can't change our age, our basic genetics, or our family's medical history. And both types play a huge role in how susceptible we are.
Okay, so we've got the seed and we've got the soil, but what about the weather? What about the overall climate? Well, that's the environment, and it is the final and absolutely crucial piece of this recipe.
Our environment is, it's basically everything external to us. And we can kind of group it into three big categories. The physical world around us, the biological world full of other living things, and the psychosocial world of our culture and society.
Let's make this real for a second. The physical environment. That's things like the quality of the air you breathe or whether you have access to clean water. Biological. That could be the types of insects that live in your area. And the psychosocial one is massive. It covers everything from cultural beliefs about health to the daily stress you're under. The environment is the climate that can either help a disease flourish or stop it cold.
This quote from the source material, wow. It really makes you stop and think, doesn't it? It's saying that our collective behaviors, our societal choices, are actively creating the environment. We're not just passive bystanders here. We are literally creating the conditions that make us sick.
So once everything aligns, the seed, the soil, the climate, what's next? How does that initial spark actually morph into a full-blown sickness? Well, this process is called the natural history of a disease.
It happens in stages. First, you have pre-pathogenesis. All the ingredients are there, but the agent hasn't actually gotten into the host yet. Then pathogenesis begins. The seed is planted. After some time, which can be days or years, the disease crosses what's called the clinical horizon. And that is the moment you finally start feeling sick. Before that, everything is happening silently. And finally, you get the outcome: recovery, disability, or worse.
Now that whole idea of a silent period before you feel any symptoms,
That is one of the most important ideas in all of public health, and it brings us to our final, really crucial point.
So this is the big question. We always focus on the people who are obviously sick, right? The ones going to the doctor, the ones with a diagnosis. But what if they are just a tiny, tiny fraction of the bigger picture?
This is what's known as the iceberg phenomenon. And the idea is that for almost any disease you can think of, the cases we actually know about are just the tip of the iceberg. Under the water, there is this massive hidden population of people who are either undiagnosed, pre-symptomatic, or just carriers who can spread the agent without ever getting sick themselves. This slide just shows it perfectly. Above the water, you've got the cases we see and treat. But the real story, the hidden majority, is down below. People who have a disease but don't feel it yet. People with cases so mild they never go to a doctor. And people who can spread it without a single symptom. This is especially true for things like high blood pressure, diabetes, and so many mental health conditions.
And this is exactly why it matters so much. Think about it. How do you stop a disease when most of the people spreading it are invisible? How do you help a community when you can only see a tiny piece of the problem? That huge, hidden part of the iceberg, that is the central challenge for public health.
So the next time you think about being sick or being healthy, remember the recipe. Remember the seed, the soil, and the climate. But more than anything, remember the iceberg. Because what it teaches us is that in public health, and maybe in life, the biggest challenges are often the ones we can't see at all.